Dolly has one of the most extreme voting records has the most extreme, I won't even qualify it. She has the most extreme voting record of all the legislators in the Greenwich delegation. You wouldn't believe what she's voted against. Now this may not be a big issue to Greenwich in general, but it's a big issue to me. She voted against civil unions. And the reason she expressed for voting against civil unions is it violated her personal religious beliefs. Now, I'm a Catholic. I have personal religious beliefs. God knows my church has religious beliefs, but I would never impose my religions on people that don't practice my religion. They have the right to choose for themselves their lifestyle. They have the right to choose for themselves how they're going to run their life. And if we have a committed gay couple, to me, it's a moral issue. They are a family. You're talking about, remember Reagan with family values? That's a family value to me. And she was the only one that voted against civil unions. We've just come through one of the most corrupt administrations anywhere.
And she was part of it. And she knew it. She has ethics.
Absolutely. And shall we call the administration what it was? It was the Roland Rail administration. One of the most corrupt administrations anywhere in the country. If you had asked me a few years ago, could Connecticut have a New Jersey-style scandal? And frankly, New Jersey's scandal was nothing compared to what Roland did that we know of. But Dolly voted against campaign finance reform. And why did she say? What was her excuse to vote against campaign finance reform? It was she didn't want public money used for campaigns. Well, in my view, we've got to have it. We've got to have a system set up so that somebody of modest means
can run for office.
It was the right thing to do. The law struck the balance. And what the law basically says, and I don't want to bore you with this stuff, but I've been doing a lot of research, so I thought I'd pass it along. Essentially what it says is you can opt out of the campaign finance. You can fund your own campaign. If you are a multi-billionaire and for some reason you want to get into public office, and they seem to want to, you can opt out of the system. But if you do, the system is going to allow your opponent to match you and actually to exceed you. And it's a brilliant compromise. And I commend the legislature for passing it, and I condemn Dolly for voting against it. What about her voting record? There are other things. Oh, she has one of the worst environmental voting records of anybody in the state legislature. I was frankly shocked and surprised, and I will admit that. But the League of Conservation Voters has ranked her at or near the bottom for at least 5 years. That's as far back as I've gone. My guess is that if I go further back, she's going to still be an anti-environmental voter in the legislature. So that's an important thing. We're in one of the most polluted areas in the country. Our ozone levels and the pollution we get in the air coming in from the prevailing winds. The Long Island Sound is one of the most endangered areas for pollution from pesticides, from fertilizers, things like that, household waste. And yet, we have an anti-environmentalist legislator speaking for us in Hartford. Oh, okay, how about this? I'm thinking of what's in my stump speech. See, I've got all the statistics in the stump speech. You know, they're not quite there, but they're almost there if I fake it a while. 400,000 people in Connecticut do not have medical insurance. They're not covered by Medicaid. They're not covered by Medicare. They don't have employment insurance. 400,000. Now, where do those people go? I'll tell you where they go, because one of my brothers was an emergency room doctor. They go to the emergency room, which is one of the most expensive places to get treatment. And who pays for that? Well, anybody that uses a hospital, anybody that pays health insurance, anybody that pays their taxes. You're paying for the most expensive form of treatment. But that's if they go to the emergency room. The real tragedy is they don't. and they don't go until they get really sick. So what we need in the state is universal health care. And I'm glad to say that now both gubernatorial candidates have come out with a scheme for universal health care. They're not exactly the same, but they both build on public-private partnerships, which I think is the way to go. And they have different funding mechanisms. I'm open to either of the funding mechanisms. Closing loopholes in the corporate tax system, which is DeStefano's approach, or a combination of voluntary payments by employers and some of the syntax and some of the mechanisms that Dan Malloy has advocated. The important thing is we got to move towards universal health care. It's too important. It's too important to people to have dependable, affordable, portable health care. So that's a key issue. Now, where does Dolly stand on that? Well, I don't think she's taken a position on universal health care, but I can tell you that she voted against raising the income limits on Medicaid so that families and children could be covered by Medicaid, which in Connecticut we call Husky, but I'm going to call it Medicaid because that's the term I know. She voted against that. She voted against a program to assist seniors in dealing with the confusing Medicare D-prescription drug program. And this was a bill that was passed over her negative vote. And it was to assist seniors, but it was also to close gaps in Medicare coverage. It was a very important bill. Now, I don't support the Medicare D program. We all know that that was a Bush giveaway to the pharmaceutical industries and the insurance industries. But it's important to the state to cover those gaps, make sure that people, seniors that need prescription drugs, have prescription drugs. She voted against that. So you can pretty much guess where she stands on the idea of extending health care. Because any universal health care program has got to start with the children. There's no question about that. That was actually Dan Malloy's first suggestion when he was suggesting an incremental approach. You start with the children. And if that's the practical thing to do, if that's what can get through the legislature, then I'm in favor of it. But we've really got to move toward more universal health care. There's just really no question about that whatsoever. Well, there's long-term health care happens to be an interest of mine. When I was chairman of the Board of Social Services, frankly, one of my accomplishments that I'm most proud of is we kept Parsonage Cottage open. It was going to be closed down. We had it transformed to a state-of-the-art licensed home for the elderly. And to this day, 40 seniors live there in very nice surroundings. We are facing a shortage in long-term care in the future. I mean, people are living longer, but that means they're, in the latter part of their life, they're going to need help. One of the things I also did as chairman of the Board of Social Services is to establish a program, a community-based care program, so that seniors in Greenwich could stay in their homes longer, that they would have services brought to them. And I'm sad to say that some of the services we had in Greenwich, like the home health care program, the nursing program, have been cut back after I was no longer on the Board of Social Services. But that's the sort of thinking we need statewide. We have to care for our seniors. We have to have preventive health care available. We have to give them support. Frankly, the longer somebody can live in their own home with assistance, the better it is for them and the better it is for all of us, because that is